Today at ESC 2025, I presented the results of the double choice trial. This is a German trial, a 2x2 factorial randomized non-inferiority trial that was conducted at 10 German sites, looking at patients treated with transfemoral transcatheter aortic valve implantation. And we looked at two different things. We compared two different anesthesia strategies. The standard of care, which is giving patients local anesthesia and conscious sedation and some arterial and venous lines, as being performed in the majority of centers nowadays, and a minimalist approach, skipping conscious sedation and also skipping arterial and venous lines and so on. This was one comparison within this 2x2 factorial randomized trial, and the other comparison was between two different self-expanding valve types. The prototype of self-expanding devices, the evolute valve and the accurate valve. When it comes to the results of the trial, when we looked at the comparison of the anesthesia strategies, the primary endpoint of the trial was a combination of death, neurologic events, infections, vascular and bleeding complications, and the minimalist approach was non-inferior. And in the per protocol and as treated analysis, it was even at least numerically superior to the standard of care arm. Regarding valve strategies, the primary endpoint was a combination of death, stroke, moderate or severe aortic regurgitation and permanent pacemaker implantation at 30 days. And again, in this comparison, the accurate valve was non-inferior to the evolute valve, and the difference was mainly, or the numbers were actually better for the accurate valve, and the difference was mainly triggered by high pacemaker implantation rates. So overall, a little bit of a complex design, but interesting findings. They could have implications for how we treat our patients, particularly for the anesthesia strategies. So it seems that streamlining procedures, skipping conscious sedation, skipping some extra invasive procedures could benefit patients, at least the majority of them. As for the valve comparison, the outcomes were quite encouraging for the accurate platform, but as you may know, unfortunately, this valve is not available for us anymore, as it has been withdrawn from the market a few months ago.